Hey guys, this is Alicia. Um, my project is on Crohn's disease, pathophysiology. So Crohn's disease is a type of inflammatory bowel disease and it causes swelling of the tissues in your digestive tract, which can lead to abdominal pain, severe diarrhea, fatigue, weight loss, and malnutrition. uh, Inflammation caused by Crohn's disease can involve different areas of the digestive tract in different people, and most commonly the small intestine. This inflammation often spreads into the deeper layers of the bowel. Um, Crohn's disease can be both painful and debilitating, and it can sometimes lead to life-threatening complications. I liked this picture. This shows a good example of what the cobblestone looks like. That's one of like the telltale signs of Crohn's is this cobblestoning in the intestine, and you can kind of see how it, narrows it right here. Etiology. The exact cause of Crohn's disease is unknown, but there are several risk factors, including family history, smoking, use of oral contraceptives, and diet and ethnicity. A combination of factors, including deviant mucosal immune responses, intestinal epithelial dysfunction, and defects of host interactions with intestinal microbes, are likely to contribute to Crohn's disease. Clinical manifestations. The clinical manifestations of Crohn's disease are fatigue, prolonged diarrhea with abdominal pain, weight loss, and fever with or without gross bleeding. However, as many as 10% of patients do not have diarrhea. Poor growth is common in children, and it may be seen before other features of the disease become evident. Some patients may present with a fistula or an abdominal abscess, both of which can have varied clinical features depending upon their location and severity. And they may end up having to get like a feeding tube or a stoma. Like this little boy, his name is Matthew, and he ended up having to get a feeding tube from his Crohn's disease. Nursing assessment. So I'm going to go over some subjective and objective signs and symptoms of Crohn's disease. So some subjective signs and symptoms would be fatigue, abdominal pain and cramping, reduced appetite, and pain around the anus due to a fistula. Some objective signs would be fever, diarrhea, blood in the stool, mouth sores, weight loss. They could have drainage around the anus due to a fistula, inflammation of the skin, eyes, or joints, inflammation of liver, bile ducts, kidney stones. They could even end up with iron deficiency anemia, and in children, there is usually a delayed physical growth and sexual development. Diagnostic testing. Diagnostic testing. So you may see laboratory testing of blood and stool. They may order x-rays of the upper and lower GI tract with or without contrast. They may get a colonoscopy, which allows the doctor to examine your large intestine by inserting a flexible lighted tube through the anus. They might order an endoscopy, which lets the doctor examine your GI tract from the top down by using a lighted flexible tube that's inserted into your mouth, and it goes down your esophagus into your stomach, and it can go as far down as the duodenum. And this is what that picture is right here. It is from an endoscopy, and you can see, this irritation and inflammation going on here. You may also see a biopsy, which is where they'll take a small piece of tissue from the GI tract and it will be removed for testing. They also may have small intestine imaging that involves oral contrast that can be seen on a CT or an MRI. Medical management. So, some pharmacological treatments that someone with Crohn's disease may get, they might have corticosteroids like prednisone. You might see them taking oral 5-aminosalicylates. You might see them taking azacin, Purinthol, Trexol, Entyvio, Cipril, Flagyl. You may see them take antidiarrheals, pain relievers, and certain vitamin and mineral supplements. There's not like a cure. This medicine doesn't cure it, it just relieves the symptoms of Crohn's disease. If no lifestyle changes, drug therapy, or other treatments do not relieve the symptoms of Crohn's, surgery may be recommended. And half of the patients with Crohn's disease will, in some time in their treatment, will require surgery. But unfortunately, surgery is not a cure. So some types of surgery that you could see for Crohn's disease would be a strictureplasty. This widens narrow areas of your intestine that could lead to blockages. You could have a fistula removal, which closes, opens, or moves or drains a fistula that doesn't heal with medication. You could have a colectomy, which removes your colon when it's badly diseased, but your rectum stays in place. You could have a proctolectomy, which removes your colon and rectum. You could have an endoileostomy, and this is actually a type of proctolectomy that reroutes the end of your small intestine through a hole in your abdomen called a stoma, and then your waste will drain into an ostomy bag outside of the hole. You could also have a bowel resection, which removes part of your small or large intestine that's been badly damaged, and it connects it to healthier parts of the intestines. You could have an abscess drainage, which is where your surgeon will cut into an infection into your belly or your pelvis or around the anus and puts a tube in it to drain it. You could have an ileostomy, which reroutes stool either temporarily or permanently through a hole in your stomach called a stoma, like we mentioned before. You usually get these to help like your intestines heal after some sort of operation, to help remove or not remove, reduce inflammation, to kind of give your bowels a break for a little while. You could also do this while they're working on a different surgery, like with your anus or your rectum, just to let those other areas heal. And like the same way with just the endoileostomy, your stool will drain into an ostomy bag. Nursing interventions. Some nursing interventions for Crohn's disease would be to provide emotional support to the patient and their family. You need to encourage them to schedule rest periods all throughout the day and emphasize the importance of rest. If the patient is receiving parental nutrition, you need to provide the site care. You need to administer iron supplements and blood transfusions if they're ordered, and administer the medication as it's ordered. You should provide good patient hygiene and oral care. You need to make sure you're taking a strict I&O and daily weight with the patient. You also need to evaluate if the medications that you're administering have a therapeutic effect. You could provide nutrition education for the client and educate them on possible adverse effects for the medications that they're taking. So, some teaching that you'll want to do with your patients is to educate them to take the medicines as they're prescribed, and they need to increase physical activity. They need to practice relaxation, breathing, and meditation exercises. They should avoid foods that make the symptoms worse, like something spicy or really fatty, something that might upset their stomach. They need to eat a healthy diet. They should also avoid smoking tobacco. And, they should get emotional support from friends, family, or a counselor if they need to. They need to see a doctor if they are vomiting, have new or worsening abdominal pain, have a fever, if they're unable to pass stool or gas, if they lose consciousness, or if they have new or an increased amount of blood in the stool. So for a patient with Crohn's disease, we would try to educate them to avoid foods like that contain caffeine. They need to avoid alcohol and spicy food, anything that could make the symptoms worse. They should reduce dairy and avoid high-fat foods. They need to steam or bake fresh fruit and vegetables, and this will kind of help reduce discomfort from the fiber of them. They need to avoid large meals, and they need to increase their water intake. Prognosis. So most people with Crohn's disease enjoy a happy, healthy, active life. While there isn't a cure for Crohn's disease, treatments and lifestyle changes can keep the disease in remission and prevent complications. Thank you guys so much for watching. I appreciate it, and I hope you guys have a good weekend.